but I will address you some hepatitis B testing, some serologic tests, and you have a result of hepatitis B panel or blood test. And this result, do you think that it suggests something in this patient? It's a kind of chronic, vaccinated, or susceptible hepatitis B virus. With this kind of result of blood test, ABS-AG and total anti-APC positive and anti-ABS negative. Does this indicate something?
I see. I think that maybe it is the chronic hepatitis B.
Chronic hepatitis B infection. Does it
Yeah.
mean that? Okay, you're right. Yeah, you really did a good job. Yes. It's all thing I want to tell you guys. And this result, it suggests a condition of chronic hepatitis B infection. And you want some more tests about HBV DNA or ABS-AG or anti-ABS-AG? Okay, but the test results are pending. We haven't had the test result, and I will update you after the case. Okay? Yeah. Okay. Okay. This kind of test, fibrous scan. Okay, what does it know about that? Can you tell me something about fibrous scan? Do you think it's necessary for this patient?
Yes, it's very important to know how about the liver is a fibrosis score, and also related to the treatment therapies.
Okay.
Yeah.
Okay. Is this okay? I have one personal questions about your hospital. In your hospital, your hospital have a fibrous scan?
Yes, we have.
Yes. Okay. So, do you think that it measures about fatty change of your liver, the amount of fat in your liver? Do you think fibrous scan it gives you some information about the amount of fat in your liver?
Because fibrous scan like ultrasound, but special ultrasound to know fibrosis score, and we don't need to liver biopsy to diagnose how about the kidney, how about the liver. So we can use this technique to check. I think it's a set for the patient.
Oh yes, I totally agree with you. FibroScan is a kind of specialized ultrasound machine for your liver, and it's a non-invasive test to evaluation for your liver. And it has a two kind score, CAP score and fibrosis score. CAP score, it measures the fatty change in your liver. It means the amount of liver with fatty change. And the picture here, and you can see the table here, it shows you the ranges of CAP score and the matching steatosis rate and amount of liver with fatty change. And the patient, the result of CAP score is at 1. It means the amount of liver with fatty change is about 11% to 33%. And what about fibrosis score? Fibrosis score, it measures the amount of scarring in the liver. And this test, it measures scarring by measuring the stiffness of your liver. And actually, we have at 0 to at 2 fibrosis grade. With at 0, no liver scarring, and at 4, it means cirrhosis. And the patient, he has at 2, it means moderate liver scarring. Because we have a fibrous scan, so we can evaluate about the amount of fat in the liver and about the fibrosis of the liver. So most of patients, with disease in the liver, they almost don't need biopsy. Do you have any questions about fibrous scan? If it's very clearly for you understand, please comment in chat box for me. Okay, you can say yes. If you don't have any questions, I just keep my presentation. Okay. 3 most likely diagnoses for this case. What is our assessment? Something abnormal in colon, IBD, IBS, or something about hepatitis B?
I mean, when I asked the patient about his, that his symptom and sign, I guess that he might have first of all is IBS syndrome. IBS.
IBS syndrome. Okay.
Yeah,
Yes.
because he said that he's just have been divorced recently, so I think he may have some stress that might affect his gastrointestinal system. And I also guess that he may have a colonitis. So
Colonitis. Okay, colonitis.
And finally, I guess he might have colon cancer.
Yeah, colon cancer.
Yeah, and after asking about lab tests and examining, so the diagnosis is more clearly more clear right now that it's a carcinoma, a colon. It's
okay.
rectal carcinoma.
Okay, actually, it's sigmoid.
Sigmoid colon carcinoma. Yes, but could I ask some question about that diagnosis? Because as I remember, if you have a tumor in the ascending colon,
yes.
you might have diarrhea because it affects the water absorption water absorption in your digestive system. But if you have a tumor in the descending colon, the patient is more likely to have constipation.
Constipation. Yes, constipation. Okay.
Yeah. So this patient, our patient today, he have diarrhea, but he have a tumor in sigmoid colon. So I a little bit confused about this symptom.
Okay. You see something abnormal in the patient's symptoms and the diagnosis? Does it mean that?
Yes.
Okay, I can show you something here. Okay. The patients, he have a loose stools, and the physical exam is decreased stool caliber, and the colonoscopy is a cauliflower shaped mass. Yes. When the patient with some tumor or some mass in descending colon, it can make the patient he have something like constipation. But it's if the mass it is I don't think that just like when constipation means you have something blocked in the waste, the feces. The feces pass into the descending obstruction. But this patient, the mass, actually I haven't mentioned this about the size of the mass, but it doesn't block. It doesn't give. We don't have any size of obstruction here, and the mass it is block the way that the feces passes the way. And one more thing I think you should know is that if there is a mass in descending colon, like sigmoid colon cancer, it can make for your stool, decrease stool caliber, and it can be shapeless, or it can be mushy feces. And one more thing, the patient have some loose stool, so we just give a diagnosis here is chronic diarrhea. We give one more diagnosis here is chronic diarrhea. So if I were the patient's doctor, I will run more tests to diagnose about chronic diarrhea, like some examine about stools or some microscope or something about stool specimen to diagnose what caused the patient's diarrhea besides sigmoid colon cancer.
Thank you.
Okay. As I said before, I have something confusing when talking about the patient's symptoms. So if you have any questions about the patient's symptoms and the signs, you can inbox me after the case. I can discuss you about the patient's symptoms and the diagnosis.
Okay, thank you.
Okay. And we have 3 diagnoses most likely: sigmoid colon cancer, chronic hepatitis B infection, and chronic diarrhea. And Dr. Viet, he says that he think about cirrhosis. Okay, actually, I don't agree with you about cirrhosis because the patient, he has no signs of cirrhosis like jaundice, edema, or fetal hepaticus. Although the patient, he has hepatitis B virus, but he doesn't receive any treatment before. So I think cirrhosis is right now, I don't think the most likely diagnosis for this patient is cirrhosis. But we need some more tests to follow the patient to evaluate about the cirrhosis. So next, I just move on some discussion here. Okay, I'll give you some information about sigmoid colon cancer and hepatitis B virus. If the patient, you think he or she may be likely a colon cancer, for this patient is sigmoid colon cancer, there will be some evaluation, pre-treatment staging evaluation to give the patient the best treatment for the patient. So there will be something like TEM staging, physical and endoscopic examination, and some imaging or tumor markers. What about imaging? You can divide it into local imaging by CT or MRI of the abdomen and pelvis, or evaluation for distant metastasis like contrast enhanced CT scan of the chest and abdomen and pelvis. And the management overview of management about sigmoid colon cancer. We approach to the patient by multidisciplinary management with surgery, radiation oncology, medical oncology, or something with radiology or pathology findings. And always keep in mind that management according to initiate clinical state. I mean the clinical state upon TEM staging. And the one thing I want you to remember that surgical approaches is the only curative treatment for sigmoid colon cancer. And also we need some adjunctive therapies like diet and exercise. Okay, do you have any questions in the pre-treatment staging evaluation or management?
I have a question. You mentioned about contrast CT scan, but this patient has chronic hepatitis B and also cirrhosis. So, do you think maybe contrast affects to liver function?
Contrast to liver function. Okay. I can say that you before right now. Just upon my knowledge, I just contrast enhanced CT scan if the patient was have something abnormal in kidney function. You have some notice or have a procedure about the patient when they have to perform contrast enhanced CT scan. But with the patient, he has something deficiency or something abnormal in the liver. Right now, upon my knowledge, I don't think it's the kind of a problem. But if you don't mind, I wanna look for more information and answer you after the case.
Sorry, I can answer your question about this. You worry about the kidney function of this patient, right? Because like you afraid like we go with the CT scan, contract in his CT scan of the chest or even abdomen. Maybe abdomen. Like we want to check about the colon problem. So the patient only have problem with the hepatitis, chronic hepatitis, and maybe his liver damaged and can be like have some scare in there, but you care about the kidney function, right? So do you feel any connection between liver function and kidney function when we go with the contract in hand CT scan? Know what I mean? Like
Just mean the liver disease relates to kidney function.
Yeah,
Of course,
it's not.
we have the disease syndrome, liver kidney syndrome. That means when the liver function decrease.
Yeah, I
affects
know.
To But
I know about that. Yeah.
In this patient, I not mention about kidney function. I only worry about the liver function. And my experience when some patients have problem with liver like cirrhosis, maybe. Of course, this patient at the moment the patient do not have any change in AST and also some liver, but I worry some.
Okay, I understand why you worry about this patient because the patient have chronic hepatitis. But as we know about the contract, meaning here like radio kind of chemical, and that can go secret by kidney. I don't see anything like we need to have the some contraindication if the patient have the liver failure or not failure but chronic hepatitis, and we warning the patient with these contrast enhanced CT scan. If we worry about the kidney function, and maybe you said the patient can have the syndrome when in the late stage with the liver and the kidney can get affected together. So if the patient have that, we need to go check the urine analysis, and you go with the BUN, creatinine, or even like we check about the urine output, and should the patient have the acute kidney failure or kind of kidney problem in there. If the patient negative, so we'll go with that. No hesitation, because like patient don't have any evidence with the kidney failure. We care about the kidney failure. We didn't care about the liver. If patient have connection, so let's go with the kidney function test. Yeah, and we will make the decision with that. That's a really good question. I think, and yeah, we can. We always think about some chemical can affect the patient when we do the test.
Okay, thank you, Mr. Okay, thank you for supporting me. So. Okay, did you guys have any questions?
Wow, very interesting question here. Have one question about Tắc Minh. Ask a question: why does a patient with a colon cancer usually have the metastasis in the lungs?
Okay, actually I have no experience in this problem, so anyone can support me, or can anyone answer the question for me?
All right, I will answer that question. That's easy, huh? All of the metastasis condition in our body based on the lymphatic system. So they can, the tumors, like the cancer cell, can travel anywhere based on the lymphatic system. So why they go with that place? Why they didn't go with the other organs? Why they just go with they have choose specific place for travel the cancer cell in there. So based on the lymphatic system, so according to you can go with the lymph node or lymphatic drain system, kind of like that, and you go with the lymph node, and you will see like where they can drainage means like they go back from this supply to not supply, that is go from the one place. For example, like for the colon, let me check the colon where this lymphatic system can go. Well, with the colon, this is usually metastatic lymphadenitis, to the uh, they will go with all of the superior mesenteric lymph node can receive the drainage lymphatic system from colon. We have the colon. We have kind of from this is the splenic flexure to upper rectum. Okay, so let's go with that. And then where they travel with the inferior mesenteric veins, or sorry, it's not vein, it's a lymphatic system here, and they go up and up. They will drain it to the if for the lungs, it's the hilar lymph node cluster. Ở xung quanh cái rốn phổi nó sẽ có cái hệ bạch huyết ở đó ha. Cái này nó giống như là cái việc mà đi về của hệ bạch huyết vậy đó. Thì cái việc mà di căn nó sẽ phụ thuộc vào cái đường đi của hệ bạch huyết các bạn. Thì tại sao người ta nói là colon cancer nó đi theo cái đường đi của hệ bạch của lên cái lung, nó di căn ở lung, thì nó sẽ là đi theo cái hệ bạch huyết. Cái đó là cái quyết định cho cái di căn của các bạn. Bạn sẽ file hết tất cả cái hệ system, cái lymphatic system nó go dựa trên cái việc metastasis nó go dựa trên cái lymphatic, mà nó sẽ có cái formula cho nó luôn, là ví dụ cái này thì nó sẽ go vô cái này, nó đổ vô cái này, vì cái di căn thường gặp ở cái vị trí này, nó chọn cái vị trí đó luôn. Bạn không cần phải không phải nó ngẫu nhiên đâu, nó có xác suất ở trong đó và nó có cái con đường đi. Bạn có thể tìm hiểu thêm nha, các bạn có thể tìm hiểu thêm về cái lymphatic system drainage.
Yeah. So I just moved something about hepatitis B virus. Some the hepatitis B panel of blood test you can see here. Yeah, something susceptible vaccinated past infection or acute or chronic, and overview some management of chronic hepatitis B virus. The first thing is about indications of viral therapy. Always keep in mind that the decision to initiate treatment is primarily based on the presence or absence of cirrhosis, the ELT level, and the HBV DNA level, and antiviral agents. Treatment strategy for chronic HBV typically include PEFN or nucleotide analog like entecavir or tenofovir. And what about the management of acute hepatitis B virus? For most patients, treatment is mainly supportive, and the role of antiviral therapy remains unsettled, remains changed. So, but for those who require antiviral treatment, entecavir or tenofovir are acceptable options given as a monotherapy. Now, I'll give you some, brief information about hepatitis B virus. And it will be take extremely a lot of time to discuss, about hepatitis B virus in depth. So if you want to know more about it, I can give you some links or some webs. You can look for a lot of information about this in this website. Yeah, okay. For this patient, do you have any questions about assessment about the patient's medical history or something about this patient? If you don't have something you don't understand or you want to know more detail about this, you can raise your hand. I can invite you, or you can try in the chat box. It's okay. Okay, I hope all of you guys have a great time practice English here.
Okay, thank you so much, Dr. Huong.
Yes.
So how you feel today? I mean, sorry for everyone, is it have the good presentation or even good time in the room, we call the kind of room when you go there and collect the medical history? How is it going?
Did you have any experience with standardized patient?
Lower colon cancer hepatitis liver because of the venous, not because of the lymph node. Let's go with the lymph node. Alright, so I will send you some document for that. I'll have you to read more about the reason why they go with the metastasis. Alright, man.
Thank you.
Yeah, okay. So today we have any comments or any opinion for our talk today before I read some things. All right. Thank you so much for the very good presentation and like helpful for you guys to understand about the case and also for the solution and also the very general treatment for this case.